Hello everyone out there. Welcome to Creating the World We Want. Our ambition is to articulate and analyze our current society to enhance our civic systems to build towards a future that we all deserve. We're honored to have Don Berwick as our second guest. It's an honor. Dr. Berwick has gotten his BA, his MD, and his MPP from Harvard University, which is a pretty amazing feat. He co-founded and was CEO of the Institute for Healthcare Improvement, which over the past 25 years has been analyzing and pushing and emphasizing really ways to enhance our healthcare system as a whole across the globe, which has been really amazing. He was appointed by President Obama as the administrator for the Centers for Medicare and Medicaid, which has a bigger budget than the Pentagon, which I'm sure we can dive deeper into. And he also ran as governor of Massachusetts. To become governor of Massachusetts, which was, very campaign that I feel like we can learn a lot about because Bob also ran, which would be a cool discussion for us to have today.
We're in a little club here.
Yeah. I endorsed you both because I believed in you a lot. So, we're going to dive into this discussion. We hope you learn. We hope you are engaged and educated about certain civic issues, and we hope you enjoy our discussion.
So again, Don, it's such a pleasure to have you here. I have admired you for a long time. I have to say I've also admired your wife, Anne, for her leadership. And this show is an experiment, and one of the things we are looking to do is get a sense of how people become the leaders that they turn out to be. So what is the origin of some of their values, of the experience that really shaped them? So could you just tell us a little bit about growing up and your family and the things that pushed you toward medicine?
Sure, Bob. And first, let me thank you, Tom, for having me here, and same for you, Bob. And believe me, the admiration goes both ways. My family is great fans of yours, and thank you for so much that you've done through many, many years. My origins are rural. I grew up in a very small town in Connecticut, Moodus, Connecticut, which almost nobody ever heard of. My father was GP in the town. My mother was a housewife and very active in the community and all sorts of progressive endeavors. It was a tiny town. I think we had well under 5,000 people, and I knew everybody and grew up in that kind of environment. Mm-hmm. I have two brothers and a stepbrother. My mother died when I was young, and my father remarried. And I came away from there with a couple of, I think imprints. One was I always intended to be a doctor. My father was my model, and I think also the communitarian spirit of a small town. Everybody knew everybody. Everybody had everybody else's back. I mean, there was a lot of troubles as well, but I learned we're part of one community, and somehow I've never lost that small town part of me. Mm-hmm. And my mother was a model of involvement. I mean, she was involved in everything. The library in the school was named after her. I mean, she was out every night at meetings, and that's my memory. Mm-hmm.
It must have been so hard to lose her and to a medical problem. Did that also drive you toward medicine?
Absolutely, yes. Yeah. I mean, it shaped me. I was 15. She died of ovarian cancer, and it was obviously a very, very rough time for everybody. Mm-hmm. But it made, I guess it made healthcare and medicine even more relevant in a different kind of way, for sure.
One of the things I'm so struck by, and watching you and reading about you, is this strong, patient, centered approach to medicine. And as somebody who's gone through his own share of medical challenges, it makes such a huge difference. And I think maybe we see a little of the origin of that commitment in the experience you went through. So you ended up at Harvard University. What was Harvard like? What year was it that you showed up there?
I was in the Harvard undergraduate class of 1968, so I went there in '64, and I was
still all male at that time.
Well, there was Radcliffe, where I met my wife.
Right.
Anne and I met the very first day we were both at college. We were lab partners in biology. Who knew? Yeah. And it was quite an experience for a kid from a very small town. The biggest city I ever went to before that was probably Hartford, Connecticut, and here I was in this overwhelmingly rich intellectual environment, people with so many different backgrounds, and I loved it. It was a bit scary, I must say, but it was great. I feel very lucky to have been there, and then I went to medical school at Harvard as well.
Just tell me a little bit, because I always love these stories. I always ask at dinner parties. So Anne walks in the room, your lab partners. What was your first impression of her?
Actually, she'll tell a story differently. My memory is of this Radcliffe girl moving her seat. She spotted me, and somehow she wanted to sit. I looked nice, she said.
She relocated.
She was probably, yeah, she relocated. And I was also sitting across from one of her friends from Providence, and I assumed she moved because of him, but it turned out that wasn't the case. So,
She could sense the positive vibes.
That's
yeah,
right.
yeah, something was going on. It took 11 years before we ended up together.
Oh, I
but,
have a story like that myself.
Do you?
Yeah.
So from those youth days, what core values were instilled in you that have kind of allowed you to become the person you are today? That drives you?
Interesting question, Tommy. The word that leaps to mind is solidarity. I work a lot outside the U.S. I become quite global in my endeavors, and people in other countries don't hesitate for a minute to use the term solidarity and to act that way. There's this basic sense of being in it together, and I don't know where that comes from in me, but I think the small town origins may be. I mean, everybody knew everybody. We were relevant to each other, and the fate was in some sense shared. So I think that certainly is part of the origin. Yeah.
Mm-hmm. I have also been around the world, and that idea of solidarity, that we are committed to each other despite differences in class or origin, is such a powerful idea. And in some ways, I think it's actually an American idea, but we've lost the terminology and we've lost the practice of it.
Yeah, now, it's almost, you're not supposed to say that. It sounds socialist or something where we're wrong. But creating the world we want, I mean, don't we want that? And we'll talk later about running for governor, but one of the strongest impressions was after a period in Washington when, oh no, don't talk that way, this is a country of individualism, and everybody, we get the best result when everybody competes for themselves. And then you go into the communities, like in this state, 351 towns, and you find, I think it's the same. I think you find the same sense of belongingness and willingness to own commitment to each other. I think it's there. Maybe that's naive, but I feel it.
Let's jump to medical school. So you arrive at Harvard Medical School, at the pinnacle of all of the medical training, in its own view anyway. What surprised you about that? What was different from your expectation?
What was different? I had been, my major in college had been what was called social relations. It was psychology, sociology, anthropology, and then got me more into the world of policy. And I didn't want to let go of that. So from the very first moments of being in medical school, I was both in it but also watching it. And I think I was a little lost about how complex the systems we were in were, and they weren't always working all that well. And it was with me from the very first day. Mm-hmm. I really was excited, though. I mean, when you become a physician, I assume also a nurse or pharmacist, there's a rite of passage where you get into command of some pretty technical stuff. I didn't know if I could handle it, but it was wonderful, just wonderful learning to kind of master the complexities of the human body and the healing process. I loved it. And then also in medical school, Harvard offered a very unusual opportunity. It was the second year they offered it, which was the opportunity to get a joint degree, to get a degree in medicine and public policy from the Kennedy School. Which was like invented for me. I mean, that's really matched my interests, so I was able to do both, and that was a wonderful surprise.
So from those studies, and I'm sure your early experiences in your career, what led you to start the Institute for Healthcare Improvement? What did you see that was going on in the system that you didn't think was satisfactory, and what did you try and build?
We're back now in the mid 1980s that your question refers to. In that period of time, so I'd become a doctor. I'd maintained an interest in public health and policy. I'd gone to the Kennedy School as well, and a man named Howard Hyatt, who was a very important figure in my career. Howard is really my main mentor and now one of my best friends. Howard had become dean of the School of Public Health at Harvard, and he had. It was a very unusual move because he was a almost Nobel quality bioscientist physician, and he moved into public health, and everyone was surprised, what's he doing there? But then he asked me to come to the school as a very junior faculty person. He was setting up a multidisciplinary center for analysis of clinical practices, which involved economists, operations researchers, psychologists, physicians, statisticians. He had the theory that when you built this intersection of endeavor, lights would turn on, and it was true. So I got immersed in this sort of, I guess today we might call it systems view, seeing the system. Mm-hmm. That was great, and I was recruited from that to the Harvard Community Health Plan, which doesn't exist anymore. That was the HMO in Massachusetts, in eastern Massachusetts, that was one of the first really solid staff model health maintenance organizations. And I was made vice president for quality because I knew the kind of the health services research part, how to measure healthcare, or how to study it. So for about 4 or 5 years, we're talking now about 1980 to 85, I was responsible for measuring and reporting on the quality of the care this good organization was giving, and it was really frustrating. I mean, defects everywhere, long waiting times, kind of okay performance, but nothing really changing, and I really got frustrated with it. I didn't have a way out. And then the CEO at the time, a guy named Tom Pyle, who had come from outside healthcare to be CEO in healthcare, he said, well, you know, if you're frustrated, why don't you look outside, look at other industries. Go, you know, we got to the moon, how do we do that? You know, how do computers get to be what they are? And that began about a 6-month journey that changed my life, which was visiting outside healthcare. I went to Bell Laboratories, I went to NASA, I went to manufacturing companies, hotel chains, and said, how do you make things better? And I discovered what is sometimes called quality management or total quality management. It was just management theory about how to support improvements. And I met W. Edwards Deming, who was one of the great teachers, and suddenly, I mean, the lights turned on for me, which I said, oh my goodness, there's a way to think systematically about how very complicated human enterprises get better, and they produce results, but we weren't using them in healthcare. And this was a journey that several of my friends and I were on around the country. We began meeting, and we eventually said, well, let's see, can we learn from other industries, bring those ways of leading and working together and being self-critical and trying things out into healthcare systems, and it never stopped. That became, it started with a philanthropic grant from the Hartford Foundation, but within 3 years we had to set up a freestanding nonprofit that today is IHI.
And do you primarily advise others how to introduce this into their systems? What is the core of the service that you offer?
It's a very complex question because, I mean, this is a 30-year-old organization now. This organization acts as a buddy, advisor, consultant, leader of collaborative efforts where we'll, originally picking a project, like maybe early efforts might have to do with improving asthma care or reducing mortality in cardiac surgery or improving or reducing cesarean section rates or improving reducing waiting times. And what we would do is take the relevant sciences, the system sciences, which is a pretty wonky idea, but there are ways to think about it, and a management and leadership style, which is very inclusive. Instead of command and control, modern organizations that work with improvement invite everybody to help. The whole workforce becomes welcome in using its ideas. So we'll go to, or rather hospitals will come to us, or today it's now nations. We work with countries and who are trying to improve, bringing methodologies to them, and then learning from each other. One of my current assignments is to lead a collaborative of 40 organizations around the United States called the Leadership Alliance that's intending to improve care, better health, and lower cost at the same time through system changes. So it's an odd organization, but it works now globally, and I spend a lot of time with very large systems.
I have a question about sort of the underlying logic that gets applied to healthcare in general. And what I mean by that is over the years, I've learned that there's a big difference between the public health perspective and sometimes the medical care perspective. And if I could summarize it probably inaccurately, but public health is thinking about the conditions that create health over time and protecting against things that would disrupt that, and looks more at systemic impacts on health. And medicine, and maybe I'm caricaturing it, tends to look at, well, once you're sick, then we're going to address your problems. So this, it seems to me, is an ongoing challenge where you put your emphasis and how you balance that. And So my question is, have you seen a progression from the one to the other, or an improved balance between those ideas?
I think your conceptual framework is I agree with it, that there's medicine, the way we built it, is sort of a repair shop. You get sick and then we try to make you better. The causal systems, the things that make you sick, that take our lives or shorten our lives, it's not the absence of healthcare generally, it's other factors. The modern phrase is social determinants of health. This is it's housing, it's transport, it's exercise patterns, it's nutrition, it's racism, social justice issues, the criminal justice system, and so on, poverty. And so that's the causal system. Public health also got a little sectored off into like vaccination and particular endeavors, but the larger frame of how do we create a healthy community is very important. And we are way out of balance in this country. There's actually research on this. When you look at the total expenditure that a nation makes on the combination of health care, that is getting into the hospital and getting fixed up, and social improvements, better transport, better housing, anti-poverty, social services. There's a sort of relatively similar amount of investment in Western democracies. We're at about 27% total. The other range is maybe 23 or 24% up to 30%, 35%. Well, the difference is in other countries, the ratio is 2 to 1. $2 of investment in social determinants for every dollar we put into healthcare. In the United States, it's not quite the opposite. We put much more money into healthcare than we do into social determinants. So we're always it's like we ran a whole country full of auto body shops, but had no work on road traffic safety. I mean, that's sort of what we're doing. We should be very proud of the auto body shops. The repair shops are very, very talented, and they do remarkable things, as you know personally.
Yes, I do.
But we can't make ourselves healthy with healthcare.
So can you
Really
help?
good quote. Can't make ourselves healthy with healthcare.
Could you dive into, for our community, maybe to understand how we built this system, why the system currently works this way?
There are many books written about that. I think for reasons that aren't quite clear to me, there was an era of soaring investment in this country in the technologies of care, hospitals, NIH, and biomedical research. Its predecessor was, of course, professional dominance, where the physicians mainly were very much in control of care, and their workplace was the hospital or the office, and that's what we invested in. When Medicare and Medicaid were enacted in 1965, they were hospital support systems. The key legislation before that was the Hill-Burton Act. That was federal investment in building hospitals, and we began to build a system in which the hospital, the technology is the center, and it's glorified, and it should be. I mean, the things we can do, are amazing. Kids today, I'm a pediatrician, kids today live routinely with diseases that absolutely would have killed them as little kids. And when I was in training, leukemia and organ transplants, congenital cardiac surgery, they're magnificent, but that's where we put the money. And once the money's there, it builds on itself. The hospitals want to be bigger, beds need to be full, and we have a payment system which says go for it. We pay basically still in this country fee for service. So if you want to make money, and whether you're for-profit or not-for-profit, you want to make money, that's how you stay in business, you're going to do more stuff. You're going to keep the MRI machine going, you're going to keep the beds full, you're going to do more interventions, and it gets out of balance. Meanwhile, housing deteriorates, our investment in good transportation, our willingness to address racism and its consequences, our investments in education, they languish by comparison. When I was running for governor, I'm sure you looked at the same data, but we had the Massachusetts Health Budget and Policy Center, and I remember making a slide. I actually showed this in my campaign. If you took our state's budget, our wealthy state's budget, and you did it sector by sector, like state-supported higher education or early childhood education or housing vouchers, everything over a 15-year period up to when I was running was down,
Yeah.
except healthcare.
Yeah.
which over that period was almost double. So it's like confiscation by health care of the determinants of health.